Hi, how you going? Kate here. Just coming to you live this Friday afternoon to talk a little bit with you about a few key ideas or a few ideas I have about anxiety in autistic kids and teens, and some ideas that might be helpful if you're one of the many people who sort of I suppose contact me or ask questions or put comments and asking about anxiety or emotion regulation issues. So one of the things that I see coming up again and again is the questions about emotion regulation and how can I help my child with that, or they're struggling with that. And often underlying it is anxiety, and anxiety disorders are the most common, I suppose, co-diagnosed mental health issue affecting autistic kids and teens and adults. So I thought I'd talk a little bit more about, what are my ideas about that, and if you've got questions about how to help your child, I thought I'd talk a little bit about it today. So one of the things I suppose I'm thinking more and more used to be when we talk about, an anxiety disorder. In my training as a psychologist, we'd kind of go through all the different types of anxiety disorders there were, and there were a set of treatment guidelines and recommendations about how we would help families and help kids if they were presenting with those. Now, child psychology is it's different from adult in terms of whilst it's a very medical model, in practice, it's about supporting the family as much as it is, or the parents as much as it is the child. So there's sort of the dual work that goes along with that. It's how is the anxiety perceived? What role is it having in the family? How are the parents coping with it? As well as on a day-to-day basis, what impact is it happening for the child and in their life, whether it's kinder or school or socialising or whatever it might be. So then you add the layer of having a child who's got neurodiverse biology happening, if they're on the autism spectrum or being diagnosed autistic, how that changes our approaches. So what we sort of know is that a lot of the guidelines and the recommendations for anxiety and treating anxiety disorders has come from big bodies of literature, not specific for autistic kids and teens. So there is a lot smaller amount of research that's come out of with guidelines and recommendations about it. So a lot of what we were doing in the last 20-30 years is really either delivering the same kind of treatment that we would for neurotypical kids, so kids and teens that don't have an autism diagnosis and are not autistic. And what we've done sort of since then is we've got better recognition of some of the differences about autistic functioning and the way that affects thinking, thoughts, sensations, all of that kind of thing. It's a whole way of being that we've begun to adapt some of what we thought was well-researched and robust kinds of treatments. So we've adapted them to try to make them more, I suppose, autism-friendly is a way of saying it, but it's basically saying how can we make this suit our client group better, but it's still been designed on kids that were not autistic. So there's problems with that. That's the way I see it, and the more and more I'm doing the work that I'm in is saying that the assumptions that I suppose these treatment modules, which most of them have a cognitive behaviour component to them, which is looking at the thoughts and the roles of thinking and what we call challenged thinking or unhelpful thinking, and how that can perpetuate anxiety disorders. And there's a behavioural component, which often is a gradual exposure to anxiety provoking situations, and we gradually skill them with their thinking skills, and we skill them with gradual exposure to the thing that causes them anxiety, and help them expand their world and help them get confident and feel capable of being able to face whatever has been causing anxiety. That's a really very, very broad brush approach to describe it. And of course, that's not taking into all the different kinds of anxiety disorders and the different nuances that need to be considered. But generally speaking, those two kind of things were the core part of cognitive and behavioral therapy. So some of the challenges with that, of course, is that it makes some assumptions when you're going into therapy about what skills kids and teens might have, because it's been based on neurotypical kids who might already have an understanding of sensations and reading them accurately in their bodies. They may already have awareness of their emotions and know how to express them, or they know what they're feeling and how to label them. Not all autistic kids are able to do that. So there's a misguide, I suppose, in terms of going, well, what knowledge do they have, and launching straight into a treatment that is not going to be designed for their neurotype. So that's one of the challenges that I think more and more we're aware of, and needing to pay attention to how does anxiety in autistic kids differ from anxiety in neurotypical kids. And there's research sort of beginning to look more directly at that, and then remodel our approach, which I think is really, really exciting. But it's all very new. So in absence of a really robust go-to guide, and I suppose every person is so individual, which is really important to understand. One of the things I think that would be really helpful, especially for parents, if they're coming in and saying, my child is so anxious, I don't know what to do. One of the things that I've been doing over the last little while in terms of skilling myself up as a therapist in this space is listening to autistic adults who have gone before us. So they're the ones that have so much rich lived experience of their own anxiety and anxiety disorders, and probably different diagnoses that they may have been given, that they can give us amazing insight and awareness about what would have been helpful for them. So that's certainly helpful for me, is listening, reading, and taking on board what they say about what happened to them when they were younger, what they were experiencing, how hard it maybe was to communicate, what exactly it was that was triggering their anxiety, depending on their ability to communicate, their awareness of what that was. Often when people can reflect back on their childhood, they can go, I wasn't able to communicate that, some sensory issues were a massive part of my anxiety about leaving the house or about going somewhere. I wasn't able to say that necessarily then, but that was a huge part of it. And so remembering that, and so kind of going, okay, we need to be really clear about what kinds of things are triggering and driving anxiety. And I think listening to the experiences of autistic adults that have gone before us is a really helpful thing to do if you're a parent struggling to kind of understand or get your child to either articulate it, because they may not be able to, and that's okay. They shouldn't be expected to. Lots of kids can't do that, and that's fine, but we can learn from other people about having some insight and making better guesses about what might be happening. So that's one thing, and that leads me into sort of thinking also about the sensory world. So it wasn't that long ago that even in that diagnostic process, that sensory, paying attention to the sensory differences of autistic kids, teens and adults was not even in the official kind of guidebook in terms of diagnosis, even though it was apparent for quite some time, since the beginning really, that sensory differences and perceptions and sensitivities and under awareness sometimes is usually there for the individual. So having a really good understanding about your child's what I call sensory profile, their challenges, what challenges their sensory profile, what overwhelms them, is really, really important in terms of thinking about what they're coping with on a day-to-day basis. So one of the things that I see, I suppose, more and more is, and hear again from autistic adults, is that those sensory differences don't go away. Sometimes some of them change over time, but they're fairly consistent and constant over lifetime. So, thinking that, when they were little and they had sensory, sensitivities, and maybe they'd notice their hands over their ears, and then now that behavior's not there anymore, that doesn't necessarily mean that sensitivity is still not there. It may just be that they're masking it better than they used to, and now that still has a toll on them day to day, but and I think perhaps what happens is that builds up over time, and again, it may be a difficult thing to put their finger on, that they're coping with that, even though it's actually causing distress and overwhelm to their nervous system. And perhaps over time that kind of creates this sort of heightened anxiety all of the time, because they're still managing that and maybe haven't got accommodations to help them with that, because that behavior that maybe they used to do isn't there. And so we forget, perhaps, if you're not someone who has those sensory differences as well, like I am not someone who has lots of different sensory challenges, I'm not autistic, so I need to be always reminding myself of that, because from the outside it might seem that people don't have those experiences, but I know from what I've been listening to and reading that it's likely they're all still there. So being mindful of that and checking in and being aware of sometimes just all the different sensory differences, and it's not usually just one, the toll that can have when they're going to kinder, when they're going to school, and that build up that can happen. And then, you know, that can help explain maybe some things like, you know, refusing to go places, or having meltdowns after big days out, or whatever it might be, is that there's this build up of stress that kind of happens, and then their their fight or flight system, their anxiety system kind of says enough and gets very overwhelmed and has a bit of a shutdown and kind of says, I can't do this anymore. And it might seem for parents like, where's this coming from? It's out of the blue, or I don't quite understand. So just keeping in mind the sensory, and that is a really integral part of an autistic experience, and how we always have to be paying attention to that. So that's one thing I think that's important, and it's definitely not usually touched on in terms of an anxiety treatment from a psychology perspective anyway. You know, those cognitive behavioural manuals don't even mention it most of the time. They may go into it when we're teaching maybe some relaxation skills and things like that, but again, some of that assumes that kids know how to relax, kids know how to tune into their bodies. So that kind of brings up some options for the interoception awareness, which is awareness of those internal body signals as well. And is that kind of all working okay, or can we do some work on recognizing some of those, or learning how to pay attention one at a time to some of those internal body symptoms, because that's going to help when we teach the relaxation or the mindfulness skills later on. But again, if we're coming in already assuming that that's all going fine, that's again based on what would be appropriate for neurotypical kids as opposed to autistic kids, where there can be some differences there. So that's just a couple of ideas. And the third one that I thought was really, really important, and I sort of touched on it in terms of what happens just with child psychology anyway, is thinking about the parent's perspective. So you sometimes have this targeted approach to teaching skills or supporting kids in terms of that kind of cognitive behavioral stuff, but then there's the parents that wrap around them and the schools that wrap around them as well. And so parent and school and kind of community understanding all need to have the same ideas and be on the same page to best be able to support kids. So a lot of the accommodations that kids with anxiety disorders are going to come from those around them. The understanding and the support and making changes and making life more manageable is going to help reduce their anxiety overall. So for parents to really have an understanding that this is not mollycoddling, this is not pandering to kids' will, this is about kids with a different neurotype living in a world that is not designed for them, and what changes can we make, what empathy can we show them that is going to help their nervous system settle. It's going to help them have success the best that they can, and enjoy life and have well-being in that life. So that might look different from maybe what we might expect if we have a kid that doesn't have a different neurotype. So we have to change our thinking. If that is a new thing for us, if we're autistic ourselves, then that's going to be your normal, and you're probably all going to be doing that sort of naturally. But if you're not, then there can be some changes that need to be made, or can be made to make things way better. Same with schools and kindergartens and community and extended family, in terms of teaching them about some of these accommodations that can be really helpful will be really beneficial for the child who has the disorder, the anxiety disorder kind of thing. So yeah, often again there's sort of this pressure for us to treat the individual because it exists in the individual, and I suppose there's a lot of merit in an approach that says it's an expression of stress. You know, if we can change the stress around the child and around the individual, then the problem doesn't lie in the individual. They're just expressing what is happening around them. So if we can make those changes and make those accommodations, and you can teach them skill as well. It doesn't have to be all or nothing, but I think too much reliance often does happen on, you know, teaching kids these skills without the support happening around them. And that's them having to work incredibly hard when they're already working incredibly hard in a world that's designed for neurotypical kids and neurotypical adults rather than autistic and neurodiverse people. So that's just a couple of my ideas that I have that may help in terms of going, well, where do we go with anxiety disorders? Because it's not as simple as just finding a therapist and kind of saying, well, they've got social anxiety or they've got a phobia or that kind of thing, just because a lot of the straightforward treatment approaches have been designed not for autistic kids. So keeping those things in mind is really important. So I'm also going to go through these kinds of things and more when I actually present the guide that I made in January. I think it was. I called it the Essentials for Anxiety and Autism, I think, and I put a few of these ideas down, my sort of my musings and what I've sort of gleaned, and put it out as a guide for people if they wanted it. And then now I've decided I'm going to sort of deliver it and just talk to it and expand upon some of those things. So next Friday at 12, I'm going to do, it's probably going to be a couple of hours, I think, with Q&A kind of at the end. So I've got posts and things going up, but I'll put the link in if you're interested in joining me. It'll be via Zoom. And I'm going to go through all of this stuff in a lot more detail as well, with a few other recommendations about what kind of tools and strategies you might be able to use to help with some of these things as well. So I hope you'll be able to join me then, but if not, feel free to share this video around to other people that might have found it interesting. And I'm going to wish you a really happy Friday afternoon, and thanks for joining me if you're with me live. I'll talk to you soon. Bye.